This COVID-19 infection control and occupational health Listen to the Experts video series was produced by the CSIR. This video clip was produced in support of the South African National Department of Health in its fight to reduce the transmission and impact of COVID-19 on South Africa's healthcare sector.
Hi everyone, I'm Matsie Mphahlele, an infection prevention and control specialist. In this video, I'm going to be talking about the steps that healthcare workers and health facilities need to take when a COVID case has been identified among staff within a healthcare setting. So the ongoing COVID-19 pandemic has claimed so many lives of healthcare workers and patients. And to some extent, it has become a threat to the economic well-being of healthcare facilities, to an extent that some of the facilities, they had to decide or contemplated closing down. COVID-19 has affected how the hospitals are designed, how they are used, and how the services are provided. Some of the facilities had to hire additional staff in order to deal with the influx of patients. Throughout the pandemic, healthcare workers have played an important role by treating patients, and they have put their lives at risk to protect others. And as such, they are doubly affected by the mere fact that they are members of the community, and also there is a risk of acquiring the disease from the patients that they treat and simultaneously transmit to other patients. Therefore, as healthcare facilities, it is important that you identify and manage healthcare workers that have been infected with COVID-19 as soon as possible, so as to prevent healthcare transmission and also to protect other healthcare workers and vulnerable patients. As more healthcare workers get infected with COVID-19, the present question facing you as healthcare facilities is whether or not to shut down a facility after a confirmed case has been identified among staff. The answer is no. There is no legal requirement in South Africa that compels you as healthcare facilities to shut down. However, as per the national guidelines on outbreak investigation, you as facilities may need to close the affected area temporarily, be it a ward, a unit, or a department. This is to allow decontamination to take place, as there may be a risk of contracting COVID-19 from the contaminated surfaces. Careful consideration needs to be made to determine whether containment of the outbreak can be made without closing the affected area. This is to avoid disruption of service delivery and also moving patients around in case risks. When temporary closure is unavoidable, you as healthcare facilities need to come up with alternative capacity measures. This is to minimize the impact on health service delivery and patient outcomes. Some of the examples that may lead to temporary closure of the affected area may be the area to be cleaned and disinfected is too large to be completed while it is in use. Secondly, the number of staff that have contracted COVID-19 and are in isolation is large, and the facility has not identified replacement staff. Thirdly, the number of staff that are direct contacts and are also in quarantine is large, and replacement staff had also not been identified. And lastly, due to non-compliance to occupational health and safety legislation and infection prevention and control guidelines. At the same time, the COVID task team should continue investigations to identify people who have come into contact with a confirmed case during the infectious period. The COVID task team should conduct a targeted risk assessment that takes into account the risks that may arise due to COVID. Remember, temporary closure of the affected area can be avoided by completing staff screening timelessly, rapidly cleaning and disinfecting the affected area once decontamination has been completed, seconding staff from the other areas, and ensuring compliance with the occupational health and safety regulation. Keep in mind, the IPC measures require constant reinforcement by means of written documents, training, mentoring, and monitoring implementation. Thank you.